Most people on Medicare are quietly overpaying for their plan, and it's not because they picked the wrong plan when they turn 65. It's because they haven't actually checked it in years. And when you pick a plan when you're 65, that might not be the right plan for you a few years later because all of the plans can change, the premiums can increase, and so forth. So today I'm going to give you an audit, 5-minute video, 5 line items like a checklist for you to check against your plan and benchmark it to make sure that you're on the right coverage, not for when you were 65, but for today, and that you've picked the right plan for today. Hi, I'm Joseph Pate, better known as Medicare Joe. We've helped thousands of people successfully enroll into Medicare by helping them through this 5-point audit that we go through. A lot of our clients renew with us every single year, make sure that they're auditing their coverage and that they're not overpaying for the same medical coverage they can get elsewhere. So here's the pain point. Medicare really isn't a set it and forget it product. The plans change every single year in the fall time. You change every single year based on your health and your life situation, and the gap between those two things are where money can quietly leak, where we're overpaying for our coverage. So this audit that I'm going to go through here in a second with you will help you close that gap and understand that the plan you have now is in fact the most affordable and the best option for you currently. Because in real life, what we see every day is someone picks a plan, they turn 65, they pick a plan, and that's right for them then. And then 4 years go by, and maybe the doctors are leaving networks, maybe they start taking new medication, maybe the plan premiums have increased several times now if they've been on it for a few years, and different carriers can offer the same coverage for less than that situation. And none of those really look like an emergency on the day, that they happen when you think about it. But when you put them together over several years, doctors, prescriptions, plan premium increases, you're probably on the wrong plan come year 3 or year 4 if you haven't done an audit to benchmark your coverage. For most people, the single biggest reason that they're overpaying on Medicare isn't that they picked the wrong plan when they started off. The single reason they're overpaying on their coverage is they have not shopped it. They have not had this audit done to make sure that they are on the best coverage. You get a letter in September every single year telling you what's changing about your medications, about your doctors if you're on a Medicare Advantage plan. And most people actually just don't even really review that annual notice of change letter. And I'm going to go over today what the hundreds of pages of paperwork you get in the fall time really need to tell you in 5 lines. 5 checks, a checklist that you can benchmark yourself, your plan rather, against to make sure you are on the right plan for your Medicare coverage. So just so we understand the size here, Medicare runs in calendar years. So plans publish for January 1st every year for your drug plans and your Medicare Advantage plans. And between October 15th and December 7th is kind of your window to do something about it. Now, if you're on a Medicare Supplement plan, you can change that one at any point during the year, bearing your health. So as I go through this audit here, some of these line items you're going to be able to tackle in the middle of the year. Some of them you might need to wait until the annual enrollment window to actually start reviewing it. So this is a good pre-education video to watch to really get an idea of what that looks like. So walk with me through this here as I go through it. Again, number 1, the single most important check is that we actually have our doctors covered in the network. So if you're on an Advantage plan, you'd pull up that provider network for the new year, confirm all of your doctors are on the plan. If you're on a Medicare Supplement plan, you'd want to make sure that all your doctors still take original Medicare. If they do, your Medicare Supplement plan will be accepted there. And then do the same thing for drugs. We're going to pull an actual list of prescription medication. We're going to run them through the Part D or Medicare Advantage plan formulary that we have. Check a few things. Did any drugs drop off that they're not covering anymore? Did any tiers shift within the formulary where now they're going to be costing more? Did any of these medications move and now have the deductible assigned to them before they end up being a copay? Because that could be a large out-of-pocket sum that you have to pay at the beginning of the year for that medication. A missing doctor or a drug that's changed around, that's your first flag. Now, number 2 is your annual notice of change letter. So the annual notice of change letter comes to you for your Medicare Advantage plan or your Part D prescription drug plan. It's required by law that the carrier that you're on now sends you one in September talking about the changes of your plan that are going to happen for the new year. Premiums can change. Deductibles can change. Copays can change. If you're on an Advantage plan, extra benefits can change. All of it. And most people take that and unfortunately it gets, lost within all the mail you're getting around that time of the year. But it's important that you open that up and you check what your monthly premium's changing to, what your deductibles are changing to, and if anything else has changed within the plan. That's your second red flag. And if you're unsure about the changes when you get that letter, it's worth a call to your agent to make sure that you understand the new plan for the new year. Number 3, this is more for your Medicare Supplement crowd, and it's one that ends up quietly costing people the most amount of money when they're overpaying their coverages. My premium. So my premium would be what you're paying for your supplement now versus the market. So this is an important one. Medicare Supplement plans, they're standardized by law. So if you're on a Plan G is a Plan G. If you're on a Plan N is a Plan N. The coverage is identical. The only thing that's different is the price you pay every year. And yes, the supplement carriers raise their premium every single year. So if you've been on the same supplement plan and haven't shopped it in 3 to 4 years, there's a really good chance that you're overpaying for your Medicare Supplement plan. Now, in most states, you do have to qualify health-wise to lower that. There's usually 10 to 15 health questions you have to answer. So it's not an automatic way to lower your premium, but it's a good check nonetheless to see what is the premium I'm paying for my Plan G versus what the Plan Gs are selling for in the market now, 2, 3, 4 years after you get onto Medicare. A lot of people find they can save anywhere from $50 to $100 a month just by shopping that supplement plan, which is a great savings for the same coverage you can get. The first 2, you got to be within the annual enrollment period window to do those. The third one, the supplement carrier, you can do that anytime during the year. It's based on your health. So if you're find that you're overpaying or you want to benchmark yourself against the market, you can do that whenever you want. Now, number 4 is my Ancillary Coverage. And this is going to be your what the Medicare really doesn't talk about much, but this is going to be like everything outside of Medicare that doesn't have coverage for. So this is going to be your dental if you're on a supplement plan. This is going to be your cancer, heart attack, and stroke coverage. Your hospital indemnity plan, HI plan if you're on a Medicare Advantage plan, and your recovery care, which is your short-term, long-term care options for skilled care. If you don't know what I'm talking about in this section here, it's very important that you get educated with this piece because this is the biggest gap that Medicare does not have coverage for, and it can be the biggest cost to you if you don't have the coverage. If you do have the coverage, it's a good idea to shop these plans: dental, cancer, hospital indemnity plans. The rates can change every single year on these products. We have new carriers that are coming to the market all the time offering preferred rates for people to make changes or replace their coverage. So if you've been on the same ancillary coverage for a few years now, it's going to be a good idea to look at that premium and benchmark that against the market, similar to the supplement plan. But again, if you don't even know what I'm talking about in this section and your agent didn't bring it up, that is a red flag. So flag this line number 4 because it's important that you're aware of what your ancillary coverage is doing in addition to what Medicare doesn't cover. Now, number 5, the last one, is I like to chalk this up as my life. So has anything changed in my life at all? Is my income up? Is my income down? Do I have an income surcharge for Part B and D, which I can maybe appeal to try to lower it with a qualifying event? Did I move to a new zip code? That changes plans entirely. Did I get married, divorced? Did my spouse pass away? There's a lot of stuff that happens in your life that, did you get diagnosed with a certain condition, right? There's a lot of things in your life that can change the reason you picked your plan back when you were 65 based on now. And it's important to understand that some of those changes can impact the cost of your Medicare. So we use this 5-line audit here when we run through anybody's health coverage on a review, which we do with our clients annually. And I want you just to look at this list here. 5 lines: doctors and drugs, the letter that most people lose or throw away, your premium versus the market, your ancillary coverages, and your own life. And if you run through this and anything has changed or you haven't been able to benchmark this in a little while, you're likely going to be overpaying more than you should, or worse, you're going to have a gap that you don't even know about yet. Let me tell you exactly what to do about this. You have basically 3 solutions. Number 1, run this audit every fall time during your annual enrollment period for your doctors and your annual notice of change form. Put it on the calendar, kind of like a tax deadline. Once that September month comes around, go through this 5-line audit and understand, has any of this stuff shifted, or have I not had a chance to even look at any of this stuff, and make a note to do that. If any of those came back as a flag that you don't have it, or that you haven't shopped it, or haven't done anything about it, don't go into it fixing it alone. This is the part where I'm honest with you. Running the audit yourself is easy, but acting on it and picking a new plan is difficult. Switching supplements, there's underwriting, layering your ancillary coverage and understanding what that is. That's where most people can make expensive mistakes. The audit is really a self-check. The fix is a conversation with an agent or a broker that you have, or with one of our team members. Be happy to help you through the process. We do it with, like I said, thousands of people a year. So run it for yourself, but it's not a fear fight if you plan on taking that on alone without having, a professional on your side. And then number 3, don't just check Medicare. Line 4 is one that most people skip, your ancillary coverage, and it's one that costs people the most when health goes bad. Medicare is the foundation of your coverage. It does not cover everything, and it's important that you know that. Your ancillary coverage is kind of the rest of the house that's being built, and this 5-minute audit can help you put that side by side and compare it to what you have now versus what you might be missing out on, I should say. And that's it. 5 line items that you should use every single year to audit your coverage, make sure you're not overpaying, and make sure you have the necessary coverage that you need. And if you know anybody that's getting on to Medicare, parent, friend, or you are, share this video with them, give us a like. Most people have never done this audit even once, and a single 10-minute check can end up saving people thousands of dollars. So it's definitely worth it. And if any of those 5 that you're going through came back wrong when you ran your audit, like I said, there's a link below. You can chat with our team and book a call. We'd be happy to walk you through an audit and see how your coverage is benchmarked against what you might be able to get the same coverage at a much lower cost. If you enjoyed this video, like I said, give us a like. If you want to be notified when we post new Medicare videos, click that subscribe button. And as always, again, I'm Medicare Joe. Thank you so much for watching our video here today, and I hope you took a couple of nuggets from it. Take care.